The world seems enthralled with hero medicine. Hardly a week goes by without the announcement of some brilliant invention or some breathtaking operation. How about Dolly the sheep? She was cloned in the 1990s and she lived another 7 years. And what about those implantable brain pacemakers used to control Parkinson's disease? Recently, significant progress in growing human organs in other animal species. But how meaningful are these captivating news stories? Are there really any miracles in medicine? Perhaps not. And perhaps health is rooted in the simple and not the fantastic. I was one of those that saw technology as the cure for all of our health woes. My career in cardiology began in the dark ages. Patients would come in with heart attacks, and we simply put them to bed and gave them round-the-clock narcotics. Soon, a compound was invented that was essentially injectable Drano, and I became a clot buster. On to roto-rooter angioplasty, and later the placement of stents in blood vessels of all types. I was a hero. And for some I was, especially from my mother. I brought people back from the brink. But slowly, a sobering recognition came to me that these heroic interventions were doing little for the long-term health of my patients. In fact, some of the examples I cited, as well as other significant landmark developments in medicine, may have little impact on the health of our civilization, let alone my health or your health. We're finding, perhaps to no surprise, that health is significantly rooted in how we live. Actions as constructive as a daily walk or destructive as that hard-to-resist cigarette. I often tell my patients that our lifestyles, how we live, this foundation of our health is like the foundation of a building. If built well, the building will stand erect, and if built poorly, the building could crack or crumble. There are many examples of adverse lifestyles' effect on health and diseases that accrue from that, but perhaps no more so than in the area of cardiology. Cardiovascular diseases are the number one health challenge facing the Western world and many developing countries. This crisis is fueled in many instances by our Western lifestyle. Chronic stress, high caloric and sugar-loaded eating, excessive sitting, and sedentary lifestyles. On the Indian subcontinent, cardiovascular diseases are epidemic. Diabetes is flourishing and obesity is rampant. Whereas on the island of Okinawa, people often live into their 100s. Why might that be? At first glance, how we live, that is, our lifestyles, seems very simple. In fact, it's much more complex, and probably more complex than the design of the next artificial heart valve. As we have explored this area of preventive cardiovascular medicine, that is, trying to change people's lifestyles, we've discovered that our lifestyles are significantly structured in our habits. Habits are those day in and day out activities and actions that are scattered through our lives. Habits are like the metal rebar in that concrete foundation. They lend it strength and they provide reinforcement. Some years ago, 20 or more now, I met a fellow named Archie. Archie was a 66-year-old businessman, and he came to us in the throes of a heart attack. Well, by then, that compound that we'd actually pioneered 10 years previously, that injectable Drano, was available, and that's what we gave him. Stopped the heart attack in its tracks, and he went on to have an angiogram, that road map of the heart arteries. Well, we found he needed bypass operation. He was not very happy, but Archie was a different kind of guy. He was a get-it-done guy, and so we got it done. He actually sailed through surgery and his early recovery, and he has done very well since. Why might that be? Archie has applied some disciplined habits to his life. He began, and still does, 100 sit-ups and 100 push-ups every day. Later, he added a weekly climb up the 4,000-foot mountains that neighbor our city. He continues to eat very few carbs, except his nightly shot of whiskey, the brand I can't mention, and now does better at age 88 than most younger people on his yearly treadmill stress test. He's had other life challenges, as have we all, but he would suggest, and I would certainly concur, that it's his discipline and habits that have allowed him to endure those other challenges as well. For many, the mere mention of habit invokes fear. I can't succeed. I tried that before and I quit. I can't change. But arguably, given the importance of habit to society and personal health, failure should not be a foregone conclusion. In fact, many, like Archie, do succeed. We have identified several ingredients to help in habit transformation, the development of positive habits, and sometimes the removal of negative habits. Tonight, I'd like to tell you of 3 of those. Number 1 is today. Any gap between the commencement of a habit and the decision to start a new habit and its commencement is fodder for failure. That is, it might not happen. Contrast, for example, I'm going to get those vitamins that were recommended to me on the way home today versus I'm going to get those vitamins that were recommended to me on Saturday when I happen to be going to the pharmacy anyway. How likely is that to happen when your friend calls and says, hey, can you go skiing with me this weekend? Not likely. Number 2, easy. Durable habits are doable. They're simple. They're not complex. I'm going to have a simple protein shake every morning for breakfast. Versus, I'm going to go to the gym for an hour and a half every day. How likely is that to happen when your grandkids or grandparents are in town? Number 3, daily. The most durable habits are done repetitively, and daily is best. I'm going to have a salad at lunch every day. In fact, the most durable habits are those that are done the same time every day. I'm going to brush my teeth in the morning, and I'm going to brush my teeth in the evening. Now, these 3 tips may seem trite: today, easy, and daily. But I tell you, they spell success. T-E-D. Yes, TED. A memory you won't soon forget. Now, in spite of those tips, you may still feel very challenged. But I want you to know that you're not alone. I, too, have had to create some discipline and habits in my life so as to maintain some semblance of mental and physical health. About 5 years ago, I decided to do some constructive thinking. And now every morning at 7, I can be found at a local coffee shop reading or writing about some important life topic to me. And then at 5:30, I exercise, even if abbreviated to fit a pretty busy schedule. I made a decision. I started right away. My habits are easy, and I do them daily. I follow TED. It's important to recognize that many of our health conditions that we're faced as a society are rooted in adverse lifestyles. It's equally important to recognize that our lifestyles, that is how we think and process stress or change, how we eat and nourish our bodies, and how we move and expend energy, serve as the foundation of our health. And it's most important to appreciate that this foundation is significantly structured and reinforced by our habits. You don't need another medical breakthrough to be healthy. You don't need a medical miracle. You can be your own hero. No, your habits might not be perfect, but they can be changed. And so it's incumbent on each of us to ask ourselves, am I living to the best of my capacity? And if the answer is short of yes, think what can change today, and remember that habits drive health.